My name is Janet, and I'm shooting this video because I wanted to tell you that AAT has been very helpful to my practice. Prior to using AAT, which was more than 15 years ago, I had difficulty closing the gut due to poor compliance with rotation diets and the expense that it incurred, plus the time preparing different food every day and shopping for it with working people and even retired people. So since implementing the AAT, it's really streamlined the practice, getting results quicker for people with less hassle on their side, and it's also improved my revenue. So if you want to give better care and more expedient and efficient care to your patients, I highly recommend using the Advanced Allergy Therapeutics as part of your toolbox in order to achieve an excellent result for your patient and your practice. Before using the AAT Expert System, I had horrible allergies myself, and I tried it on myself, and it gave me significant and almost immediate relief within 1 to 2 days. Even immediately my sinuses opened up by the third day, which I hadn't felt for 17 years. I had tried multiple types of allergy relief myself, shots, about $4,000 worth of Chinese medicine at the local Chinese medicine college, and acupuncture and herbs, and I distilled them over a few years to what actually gave some help. But for myself with severe allergies, it was so many pills you could hardly eat, and the effect was minimal. But after using the AAT, there was a dramatic relief, and there was no way I could continue to offer those inferior things to my patients. Our results from using the AAT Expert System helped patients resolve their allergy symptoms, and that also allowed me to close their gut sooner so that we could work on their other problems and immune problems. This was much easier than them using a rotation diet, much more sensible. Didn't have to prepare new food every day. You could eat leftovers. But the nice thing about AAT is that you can not only see where the sensitivities are, but you can also do something about them in the same hour. My practice has changed since using the AAT Expert System in that we're able to help the patients better. They're happy. Most of it is all word of mouth and referrals, so I don't really have to advertise other than just as a public service to let people know that this exists. And I was able to recoup the cost of the AAT system in 4.5 months, not counting the nurse practitioner's time that was doing this for our patients. AAT has allowed me to become a cash-based practice, and that part of the practice was cash. And it also attracted patients that were willing to pay cash for services and other items. Because of AAT, my patients are able to, for the most part, overcome their allergy symptoms. Occasionally there's a non-responder or partial responder only. And if their immune system is not busy fighting things that it shouldn't be bothering with, then their immune system is more able to function properly toward the things that it should be concerned with. This has resulted in happier and healthier patients, and I don't have all the calls during allergy season to try to get in for inhalers, nebulizers, and occasional steroid shots that some of them would need. AAT therapy was easy to learn, the training was excellent, and the support is excellent. I would recommend AAT to anyone who wants to help their patients better, grow their practice, be able to close the gut much quicker and easier in order to go on to other things.